under deep anesthesia is something that our practice has been performing for the last 15 years or more. It's extremely important for myself as the treating pediatric dentist here to make sure that every parent and guardian is well informed, and that's why we've created this video along with our preoperative literature to try and answer any questions that you may have beforehand. Both myself and our associate doctors try our best to provide for all dental treatment awake and safely in 1 or 2 visits in a way that keeps your child comfortable. There are situations from time to time that we need to utilize deep sedation anesthesia with our dental anesthesiology colleagues to care for your child while asleep. It's important for the parents and guardians to understand who is the anesthesia provider that will be taking care of your child during this procedure. We have been using the same group based out of Pittsburgh, Pennsylvania for several years. At our office, we have completed hundreds of cases under general anesthesia safely with this same group of doctors. Over time, we have established a relationship with them, and we would trust them with our own children. They provide quality, safe anesthesia every single visit, every single time.
Typically, we are treating patients that are quite young and cannot tolerate their dental work without being asleep. We treat patients as young as 3 years old here in our office. Sometimes it is a patient that has extensive work and would just benefit from being asleep for the procedure. Others have had a traumatic experience in the past, and we are just trying to make their experience better going forward to not develop a fear of the dentist. One of the benefits of using a dental anesthesiologist is myself as the treating dentist can spend that entire appointment just concentrating on your child and their dental needs while they are comfortably sleeping. I have at least 2 to 3 other well-trained members of our team that are with your child the entire time. We have the pediatric dental anesthesiologist with us that is only concentrating on the health and safety of your child while they are asleep. Our goal, and the goal of any anesthesiologist working at this office, is to make sure that your child is safe and comfortable throughout the whole process.
Every parent will receive a call from me to set up an appointment date. You will be given the green light to get your child's history and physical completed. It is important not to get this physical before you have spoken to me, as they are only valid for 90 days in case we have to reschedule due to your child's sickness or for any other safety reason. You will then receive a phone call 1 week before and 48 hours before to reconfirm we've received all of the paperwork and we are good to go. We require verbal communication to keep these dates and remind parents that 2 adults must attend this appointment in the same car. This may seem cumbersome and repetitive to some parents, but we take these sedation procedures and your child's safety very seriously. 1 to 2 days before the procedure, you will receive a preoperative call from our anesthesiology group, where they will go over any medical history, any current symptoms they may be having, and answer any questions you may have.
We ask that all patients not have anything to eat or drink from midnight the night before. That morning, it is very important to keep your child with you. We don't want you sending them off to school or being at daycare, because we really need you to watch your child. Hungry kids are really good at finding food, so we ask that before the appointment, you keep them at home where you can closely monitor them. We need to make sure that at the time of the procedure, their stomach is empty, which is critical for the safety of your child.
The day of, we do recommend you keeping your phone close to you, as appointment times may change, and we will call you if we are able to accommodate you sooner.
That morning, as soon as you arrive to our office, you'll be escorted into a private room and asked to sit down with one of our dentists and with the dental anesthesiologist to re-review everything that we've talked about in this video and your pre-op phone calls. We actually shut down part of our practice that day during our anesthesiology appointments. So personally, if I'm treating your child during those few hours, I don't do anything else. I don't get up to see another patient. I don't get up to take a break. It's either myself or the dental anesthesiology team that is with your child the entire time until we turn them back over safely to you, their parents and guardians. And that goes for every single provider here at Holly Tree Pediatric Dentistry.
On the day of this appointment, we will assess your child. The dental anesthesiologist likes to take a listen to their breathing and their heart and try and get a good look in their mouth to look at their airway. Kids need to be healthy the day of this procedure. We can't give anesthesia to kids that are sick, so we also screen patients for cold symptoms and other underlying illnesses. We want this whole process to be as comfortable as possible. So what we do is sneak a little medicine in the form of an injection, very similar to what they get at the pediatrician when they get vaccinations. Parents are with their child when we give that medicine, and they continue to stay with them until that takes effect. Our goal is to make this very relaxed for your child before we separate them from the parent. After the medicine sets in, we are ready to start the procedure. We'll have you go wait in the waiting room. Your child won't remember anything after that medication takes effect. That allows us to bring them into the operatory and start the IV with them having no memory of the procedure. After the IV is placed, we provide a medicine that goes through that IV and puts them into a deep sleep. Many parents are apprehensive about their child receiving anesthesia in the setting, but it is very safe to give this type of anesthetic with a trained dental anesthesiologist.
What we tell parents is that if you don't feel comfortable, you stay as long as you want. We have plenty of rooms, and sometimes parents choose to do just that, but other times they want to be home and get their child comfortable as soon as possible. Either way is perfectly fine.
We keep an eye on them for typically 10 minutes or so after the procedure is over. The dental anesthesiologist wants to make sure that they are stable and doing well before move to the recovery room. That's where you will be present with them as they're fully waking up. Most children are ready to go home with their parents in usually 45 minutes or less, but there's no rush. We want to allow that child to wake up comfortably with their parents and guardians present. The anesthesiologist will continue to check in on you until they give you the okay to go home. When your child is awake enough to say something coherent like, "I want to go home," it's safe to take your child home. It's important to remember that they will be groggy and uncoordinated for several hours after getting home, so keep a close eye on them. Do not allow them to walk fully unassisted for a few hours after you get home, because that's when the anesthesia is typically fully wearing off. We'd really sincerely like to thank you for taking the time today to watch this video and to read all of the information we've given you.
We always tell parents this may not be the most favorite thing that you're going to do with your child, but our goal is to treat them safely and effectively and to make this procedure as easy as possible for everyone.
The advantage again of treatment with deep sedation is that we get all of the treatment done at one visit. Please know that we spend a continuous amount of time every year to train, make sure our office is one of the best in the world, and that your child is given the most safe and effective treatment and experience possible.